Here's a definitional question. How would you, not necessarily a textbook, but how would you define the predictive value of a diagnostic test?
The predictive,
Yeah.
not a textbook definition.
No, just you. In other words, how would you look at the predictive value of a diagnostic test?
Well, I've got to have a level of certainty, and I've got to understand my choices, and I have to be able to convey that to someone who's dealing with the side effects and find out what's important to them in order for me to even take that and translate that into a conversation that's clinically useful. So if I'm, and I'll take the example that I just used, if I'm going to use something that's predictive and someone's asking me the question of, do I want to be treated or not be treated, I would say, you're predicting whether or not I'm going to recur. So if someone says to me, I have a 1 in 20 chance versus a 1 in 10, I'm not sure how I contextualize that risk. I can go from a no hope, 0%, to a 10%, some hope. I can understand that. But when you talk about reducing my risk by 10% versus not, and trying to mix all that up into a conversation of, is it worth it or not, that's a very difficult proposition for someone to digest.
Now, let's talk about genotype and phenotype, determining the positive. Is there a strong correlation, in your view, genotype and phenotype, in predicting the positive predictive value of a test?
Okay, so positive predictive value sounds like a textbook definition.
Nah, I want your definition. The heck with the textbooks. By the way, nobody reads textbooks anymore. It's all online.
So I think that when we start to think about what can we know from phenotype versus genotype, we don't have to look too far. We could go back to our old friend HER2. So we can look at IHC, for example, immunohistochemistry. So we've got a phenotype, so the special stain, and we've got the at least the cytogenetic view of that, a probe, a DNA probe of the chromosome 17. So when we start to ask ourselves the question of, well, do you want to live with one or the other? And you would say, well, my goodness, we've had 10 years to figure that out, and guess what? We're using both. So we use one to reflex to the other. And that's a really elegant example, if you think about it, where we've really thought through there's a cost element and a quality element, and yet there's also a backup test, and we're not using those in a shotgun approach where we have to have both tests all the time, every patient. We use those selectively, algorithmically, and patient care hasn't suffered in the process.
If you could have, one additional piece of information that would make a diagnostic test more predictive, what would you like?
Well, I think the interpretability would be probably the highest priority. So if I were to be able to have something that were easily understood by both the patient and the provider, and it was clinically meaningful, being able to provide that level of context, I think, would be the most valuable.
And one last question. I know you're going to be relieved that it's almost over. If Prosigna identifies the same high-risk group of patients with the same prognostic outlook as those recognized by Oncotype DX who benefited from systemic chemo, would that deem Prosigna equally predictive?
Focus my answer more on the prognostication. So I don't think we've really defined the predictive and the predictive spectrum well enough to answer your question squarely. But I would say that if you're looking for something that helps me as a clinician to be able to inform a decision whether to treat or not to treat, I think they both have value. Having said that, I think we need to be extremely careful about how we concluded what we concluded, both based on the historic time period that was associated with the development of both tests, and also the population of patients, and whether or not the treatment modalities that were employed during those time periods are contemporary and comparable with what we have today.
Well, thank you so much for being here.
Thank you for having me.